Whiplash is one of the most common injuries associated with a car accident. What is whiplash exactly? Think about something that's stationary and then all of a sudden gets shifted rapidly, and then it goes back. That's your neck. A car hits you from behind, and all of a sudden your neck shifts to the back or posteriorly and then comes back. We call that a rapid acceleration, deceleration. And when that happens, the joints inside your neck actually get shifted as well. Some on the top go back and some on the bottom go forward. And more importantly, the ligaments are the tissues in between each of those joints that hold them together. Again, it's the tape that holds them together. And when the joint gets shifted, they get stretched. And it ultimately results in a lot of pain because there's increased motion of those joints after the accident that allow the joints to move. And who wants to hold them together but the muscles? The muscles try to hold those joints together because they don't like that shifting. And that results in a lot of tension in the muscles and tightness. And ultimately, you have tight muscles, sore ligaments, and a sore joint capsule. Most patients get over it. 95% of patients that are in car accidents have complete resolution of their pain, often within a few months, and they gradually get better. 5% of patients don't get better. And those are the patients that the ligaments get stretched too much, or the joint capsule gets injured, much like jamming your finger. You can jam the joint in your neck too from those rapid acceleration, deceleration injuries. So what do we do about that? The patients that don't recover from physical therapy or the use of anti-inflammatories, ibuprofen, Motrin, Aleve, those types of things, or stretching and strengthening programs, we go in and we actually inject the joints or block the small nerve that goes to the joint to see if we can isolate the symptoms. Once we're able to prove that the patient's symptoms are coming from those joints and ligaments and muscles in that area, we can make it stronger and make it heal by injecting it with platelets, the cells that normally clot your blood and stimulate immune responses. We can collect those cells and actually inject them into the joint and around the ligaments that were injured or stretched and promote natural healing and help the tissues to be much, much stronger. And then once the joints are stronger and don't shift around, the muscles don't have to work so hard. So the tension in the muscle actually is relieved. It takes time for that to occur. It usually is a process of 1 to 3 months for the tissues to regenerate and to heal. But once that occurs, then we work on strengthening and get the muscles stronger again, and the symptoms improve. The vast majority of patients with whiplash can absolutely get better.